And welcome back. Many people became more aware of the importance of addressing mental health early on and providing help to those who need it. In particular, youth are experiencing increased levels of anxiety and depression and are in need of more resources. In the Bronx, mental health disparities are especially stark for boys and young men, with the New York Department of Health reporting males who are less likely to be connected to mental health care across race and ethnicities. Joining us now to give us more details is the social work assistant of the behavioral health team at VNS Health, Jaren Cabassa. And Jaren, good to have you.
Thank you for having me. I'm grateful to be here today.
Well, grateful to have you, and happy National Social Workers Month. Take the time to really highlight social workers and the work that goes on. And for yourself, I know that it's pretty intense, and you stay busy, but the fact is that you're very much needed. The work of a social worker, particularly in a climate such as this, what's it been like for you?
So the work of a social worker can look very different across the board. You have social workers in schools, you have them in hospitals, the communities. Me particularly, I work in the community. It's very hands-on. I see most of my clients once or twice a week. And we try to have a relationship where we can just continue to work on the things that we see fit.
Yeah. When you talk about the things that you see fit as a social worker, obviously your umbrella encompasses a lot. You're dealing with people with mental health issues, you're dealing with people with financial issues, you're dealing with people with a multiplicity of issues. Talk to us about the issues that you are seeing amongst the people that you're dealing with. And are there any ones that you can say, like, I see a lot in a prevalent trend?
Absolutely. Well, especially after the pandemic, there's been a lot of or increase of kids that don't want to return back to school. There was a lot of time that was allotted to them to be outside of that environment. And I think going back, they face a lot of anxiety, a lot of depression, and other social issues as well.
Yeah. So amongst our youth, a lot of needs.
Yes, absolutely. There's definitely a big need. A lot of the youth I work with are particularly males. Being able to connect them to certain services or even certain resources it can be hard at these times because not all of them are very open to receiving services, or sometimes there's a negative stigma attached to that.
Yeah, well, you brought me to my next question talking about that, because we know there's a negative stigma that's attached to social work sometimes, but when you consider yourself being young, a person of color, and then at the same time working within the community, there is that credibility factor sometimes that kicks in because of that. How much easier, I should say, is it when you have clients who actually say, hey, I got somebody who actually looks like me, talks like me, I might be able to relate with them in a manner which, if it was somebody else, I might dismiss them?
Absolutely. So representation matters, right? I think we can all agree to that. Mm-hmm. And to be able to work with a lot of the kids that I've, sometimes has grown up in the same neighborhood or been to the same schools or even participated in some of the same community programs, it's a blessing. And it's great for the kids because a lot of the times they get providers who may not necessarily really know what it's like to be living in the Bronx or living in certain situations, and I count it as a blessing that I can kind of put myself at their level and say, hey, I've been there, and let's get to the next level.
What are some of the greatest challenges you're facing right now?
I would say some of the greatest challenges is definitely due to depression. A lot of kids, especially when you're depressed, sometimes it's hard to actually want to get the help. And like I said, there is a little bit of a negative stigma when it comes to social work and mental health, because a lot of people don't want to be seen as crazy or something like that. And for me, I think being able to relay the information needed, psychoeducate people, and inform them about the wonderful resources that we have at VNS Health has been it's been a little bit of a challenge, but it appears to be working.
You've been in the business for almost a decade now. So when you talk about your work, you've seen it before COVID, during COVID, and after COVID. How much have things changed for you after COVID by way of the services and what you're seeing with people?
Well, I realized that the in-person connection is something that it's awesome. It's irreplaceable. During COVID, there was a time period where it was kind of hard. There was a lot of telehealth services that we were offering, but I really missed during that time being able to meet face to face, go into the home, go for a walk in the community with my clients, and it's just a different kind of connection, a different kind of feeling to be able to meet face-to-face in person.
So for yourself, the team, how are they able to get connected if somebody's out there wants to get connected and say, listen, I want to have a conversation, I need some services, and you may be able to help me out here?
Yeah, so we have a lot of ways to receive referrals. We get them from schools because we work in the community schools as well. We get them internally because we have a few programs in our building that work with the community as well. So, and we can also be reached on our internet platform if you want to reach out to VNS and VNSHealth.org or a phone call as well.
Yeah, a lot of ways to do that.
Yeah.
Mental health is so prevalent these days. We're having a lot of conversations about mental health. We see a lot of things where, even crimes, acts of rage in school, issues that are tied to mental health. How big is the mental health component from your perspective in what we're dealing with out here? And should we be paying more and more attention to it?
Absolutely, I think we do need to pay more attention to it. I particularly like to work with young men, and I think one of the biggest problems I do see out there is the lack of male role models. Being a male social worker, I'm a very rare sighting. There's not too many men in our field, and so I'm often requested a lot due to that fact of, being able to be a male role model or provide some male leadership. And so hopefully I encourage others to do the same and kind of come back to their communities and be those leaders of the community.
Yeah. Being a person from the community, how easy is it for you to really come in and relate and deal with some of the issues that matters at hand?
I think it's a blessing because I'm able to identify some of the issues, right? From a personal standpoint, especially being that I was born and raised in the Bronx, programs. I wasn't privileged to go to the programs that were, in the Bronx because I didn't know anything about it, and neither did too many of the people around me, right? And so now that we're kind of getting to a point where there's a lot more programs, there's a lot more accessibility to those programs. I think that is a big factor in what's to come next, right? And that's to be able to meet the people where they are.
I'm gonna throw you the big beach balls, what we call it in television. For a person who's thinking about becoming a social worker, give us the reason why you think it's important for somebody to be a social worker.
I think it's important because at some point in time, you have to kind of look at the world around you. And, for me, when I do, I want to change things, right? And to me, I think the best way you can change things is the youth, right? You have to be able to give them the tools to scope the future that, we want to see and hopefully they want to see too.
Well, Jaren, before we leave, I'm going to give you an opportunity to talk to your fellow social workers, give them a word of encouragement.
I would say if you're in this field, just, go with your heart, be as good as a person as you can, and really just learn how to be empathetic and compassionate to others and understand where they're coming from.
Jaren Cabassa, thank you so much for being with us. Congratulations, National Social Work Month, and we want to give you your props and thank you and keep up the great work servicing people in the community.
Absolutely, I appreciate it.
All righty. Well, listen, now, if you want more information, visit the website at vnshealth.org, and then also call them at 1-866-986-7691. Again, that number, 1-866-986-7691. We encourage you, don't go anywhere. We'll be back with more Open coming up right after this.